Hey everyone, welcome back to another video. In this video, I'm going to talk about male nurses working in the healthcare field in 2020. Let's get started. If you want to gain more knowledge and more skills about nursing in general, please consider subscribing down below. I upload a video every single week and you don't want to miss them. I also have free nutrition, fitness, and NCLEX guide you can download for free at my website called thesimplefitprogram.com. Alright, so let's get right into it. Male nurses in 2020. Now, I've had a lot of people message me and they want me to explain how it's been working as a registered nurse in a predominantly female profession. There's much more female in the nursing field than there is male, and that has caused a lot of interest in people and has caused kind of weird experiences for me personally. So working in a hospital setting as a bedside nurse, you're definitely going to have different experiences based on where you work, the demographic, and all these different sorts of things. But for the most part, throughout the whole year that I've been working as a registered nurse, the most important thing that I can stress for prospective students or for people that want to gain information about what it's like being a male nurse, most people don't really care that I'm a male. Most patients don't really make a point to discuss about me and my gender. They don't really care. You know, a lot of people are ill, they want treatment. Half the time, they don't even know who you are. They often ask, who's this person walking in to speak to me about my medications? Is it the pharmacist? Is it the physician? Is it the nurse? Is it the nurse educator? You know, there's so many different disciplines that come in and speak to the patient. It's kind of difficult for them to even keep track of who they are, who this person is. And of course, nurses are the person that come first contact with the patient and are with them for 12 hours. But for the most part, I feel like they don't really care what your gender is. They just want to be given their medications. They want to just get better and leave. That's all they care about. And so for the most part, no one has really talked to me about it, or no one has made it a huge point. However, I will say that there are certain situations where it has been kind of awkward as a male nurse practicing in a hospital setting. So the comments that I often get are mostly from the elderly specifically, and that's probably because they're used to a hierarchy and they're used to that traditional mindset of a hospital setting where you have a doctor who's a male and you have a nurse that's here. Whereas in 2020, it's more so that you have the doctor, you have the nurse, you have the pharmacist, you have the social worker, you have the occupational therapist, and we're all together working as a team to provide the best treatment. Now, a lot of times I get patients that are elderly and they often say, why didn't you become a physician? Why didn't you become a surgeon? And at first, working as a new grad, it really struck me. I really was offended by it. I kind of questioned, why are these people asking me this? And what you have to realize is that we're in a public space. You know, people are going to ask certain things. People are going to have their opinions, and sometimes they feel obliged to express their opinions, which is okay, and I should be able to accept that. So I often reply back by saying, no, I enjoy what I'm doing, and I appreciate that you think I should be another profession or I should go into another field, but I truly believe that this is what's meant for me to do, and this is what I enjoy doing mostly. And as a result, they tell me, oh, okay, well, it's nice to see. They usually say something positive, like, oh, it's nice to see a male in this field, you know, it's traditionally female, which is true, and I get it, but it's a bit strange that they take the time to specifically mention that. Another thing I want to mention is actually my colleagues, a lot of fellow nurses, often talk about how, oh wow, we have a male nurse, or it's great to have a male nurse on the floor because they can help with certain situations. And it's nice to hear that. I just don't really care about it too much. Like I would rather have everyone be equal and just work together and get through things together regardless of gender. But the reality of it is, in a clinical setting and working with different colleagues, you're going to get different genders. And specifically in nursing, since there is so many females and so little males, they are going to be a little surprised that for whatever reason they see a male. And how do I reply? I just say, yeah, well, I mean, I enjoy this job. I enjoy being a bedside nurse, and I truly like it. So I'm happy to work with you as well. And it's also very interesting on the cardiac floor specifically. There's a lot of male nurses that I work with, and sometimes some of the nurses come down to grab certain supplies, and they often make a note, oh wow, there's all male nurses working today. Wow, that's so different. And it's just interesting to have and hear that different perspective, because it's predominantly female, and they still, maybe they see things that have changed, and it's just interesting for them. So that's really mostly the comments I get working as a male in the healthcare field. Anyways, guys, I hope you enjoyed this video, and if you did, please consider giving it a thumbs up. Leave me comments down below. What do you think? If you're a male working in this profession, have you heard of anything? Has anyone said anything to you? I'd love to hear your feedback as well. Thank you so much for watching this video. I hope I taught you something. I hope you enjoyed it. And if I did, please consider giving this video a thumbs up. Please make sure to also check down below the description box. I do have various links that you might want to check out. For example, I have a free fitness guide, I have a free nutrition guide, and I wrote a free ebook where you can download, where I talk about the NCLEX and how I passed the NCLEX, and a specific 45-day plan that you can utilize so that hopefully you pass the NCLEX as well. All of this is free. You can check that out in the description box below. And thank you so much for watching, and we'll catch you in the next video, guys.